All right, my name is Dr. Mathew Zanis. Many of you I have met already. Some of you I've had the pleasure to work with, but I am your local neighborhood physical therapist here at Causenta. And what Tom asked me to talk about tonight is how physical therapy fits into this whole realm of treating cancer with movement to decrease pain and improve function. Okay, so when you think about cancer, you kind of focus on all the physical ramifications, right? But many people don't don't think about the fears that are associated, right? The fears of anxiety, the fears of a lot of pain, or decreased mobility and dependence on others. Okay, this can set you into a downward spiral, right? So you get on that downward spiral, you start to increase your perception of pain. Okay, so how can physical therapy help? Right, that's probably the question you're all asking. So it all comes down to pain and function. Okay, there are typically 4 pillars that we try to work with here. One being the movement. That's what everybody thinks about. Okay, it also comes down to pain education, giving you a framework on how actually pain is related to the body. Okay. The third one is sleep hygiene. We all know how important sleep is, right? All right. And then the last one is goal setting. Okay. So let's start with the first one, movement. All right, we're all familiar with that. Many of you probably think about getting bigger, faster, stronger. It's all super important, right? These are all great aspects to improve our ability to be fully functioning human beings. Okay? But what tends to happen is the movement principles that we follow also have a great effect on our pain levels. Okay? So when you think about pain, what do you think about?
It hurts.
Question, it hurts. It hurts. Why does it hurt?
Inflammation for one.
Good, inflammation's one. We have another one. Stress, good. Because it's more than just the physical, right? What we know is that our brain interprets our pain, okay? We have all these tissues in our body. I think some of you have given this conversation to already. We have all these tissues in our body, but they just are sending signals up to our brain, right? They sense mechanical stimuli like pressure, tension, stretch. But then we also have chemical stimuli like inflammation, and then also temperature like cold and heat. The deal is, though, is that our brain has to now take all that information, process it, and interpret it. Okay? So the cool part about that is that we can actually control our pain levels. Okay? Because it can interpret those messages as being either beneficial or hurting. Okay? Do you ever notice people sometimes, you can see them with you see that all the time on the news, people get impaled with an object, like a nail through the arm, but they don't feel anything. Or a soldier out in the battlefield gets shot. He doesn't know until he gets back to base and everything calms down. So we could have all this tissue damage and no pain. Okay, isn't that super cool, though, to think about? Yeah, we have a paper cut. How bad does that hurt? Right? That can be miserable sometimes, but it's the slightest little cut, only damaging a very small part of our tissues, right? The cool part that we've seen in the literature is that our brains can actually produce opioids that are 50 times stronger than anything we can ingest or inject. That's pretty awesome. And that 10 minutes of aerobic exercise is actually equivalent to 10 milligrams of morphine. How many people have 10 minutes in a day to go for a walk? Right? Heart rate at 105. That's all you need. Gym, correct? Gym, yeah. 105 beats per minute. That's all. 10-minute walk around the block. Okay? That's a pretty cool control that we have as humans because of our brain to decrease our own pain levels. Okay? What was the second pillar we talked about? The pain stuff, right? Everybody has that misconception about what pain really is. Okay? So our brain has maps of every single part of our body. Okay? Those maps are genetically encoded, meaning that we are all born with the same ones, but they're environmentally sculpted. They're malleable, they're plastic, which means your environment in which you grow up in, the social constructs of your family, emotional status, stress levels, these all have a huge role to play. What happens when we're in pain? What's a typical chain of events? I know we've all experienced pain before, right?
Reduced movement.
Reduced movement. Is that beneficial?
Grab it where it hurts.
Grab it where it hurts. Great. That's actually a really cool concept. Do you ever hit your knee off a coffee table?
Yes.
Yeah, what do? Cry? Tom cries. You rub it. You rub it, right? Why do you rub it? Well, it makes you feel better, right? It sends a signal up to the brain to inhibit that pain response. Right?
You feel like you're doing something.
It's distraction, right? It's distraction. So what typically happens is we stop moving. Now, those maps, when we stop moving or we're in pain, they become fuzzy, they become blurred, they become smudged. So our brain gets confused. It doesn't understand. Maybe you hurt your knee, you hit it on the coffee table. Over time, it may not understand what that knee is, how it relates to your body. So what it does is it sends out those pain signals to try and gather more information. It wants to collect more. So we all have thresholds. You ever hear people having a high threshold of pain? All right? If we're in constant pain, that threshold is lower. Because your body's kind of freaking out. Your brain is freaking out. It's sensitized. It wants to try and gather information to figure out what's going on. So how do we improve that? How do we make those maps sharper, clearer, more understandable? We move. All right? We start moving our body parts in ways that our brain feels is beneficial. Okay? And that has a huge impact on our sleep as well. So we do know that 30 minutes of aerobic exercise, weight training, strength training, it improves your sleep patterns. Okay? Because if we're not sleeping, we're not recovering. And then the last one that everybody across the board I see is the goal setting. Okay? We are not motivated for anything. We need something that when we wake up in the morning, we're eager to go out and do to try and accomplish. Okay? And like Tom mentioned in his presentation, here we are individualized, right? We take everybody as that unique person because we're all the same bag of bones, bag of muscles, nerves, joints, tendons, ligaments. We're all unique, right? We all have our own unique limiting factors, our strengths, our weaknesses. So from my perspective, I'm going to watch how you move and understand the stuff that you need to maybe work on to help make you bigger, faster, stronger, then also help you take control of your brain and help decrease your pain response. Okay? So physical therapy is about improving function, improving movement, but it's mostly about being involved in this team environment so we can improve the quality of life.